Bismillahirrahmanirrahim. Today we will talk about lipoma excision. First, we'll talk about the steps for lipoma excision, which are shaving of any hair overlying the lipoma if the lipoma is in a hairy area. Skin overlying the lipoma is marked using a permanent marker. Betadine solution is used to sterilize the skin. Local anesthetic is injected around the lipoma. Adrenaline may be added to this local anesthetic in order to decrease bleeding. Skin incision is done over the lipoma. Subcutaneous tissue is excised and lipoma is exposed. The plane between the subcutaneous tissue and lipoma is dissected in all directions using a hemostat. Lipoma is grasped using Babcock forceps and dissected. Ligature of any feeding vessels to the lipoma. After removal of the lipoma, the remaining dead space is inspected for any bleeding to be cauterized or remnant of the lipoma to be removed. Closure of the wound using absorbable suture for subcutaneous tissue and non-absorbable sutures for the skin. Now we will show a video showing a lipoma excision. First, the surgeon is injecting the local anesthetic around the lipoma. Notice that the skin is marked around the lipoma and a longitudinal line for the skin incision. Here, the surgeon is incising the skin using a scalpel. Until the lipoma is exposed, and then using a hemostat or a mosquito, he is separating the lipoma from the surrounding tissues. Notice that he is doing this dissection in all directions in order to separate the lipoma from all the surrounding tissues. Now he will do some pressure with his fingers in perpendicular planes in order to push the lipoma outside. Notice that the lipoma is pushed outside and then the lipoma is removed. After the lipoma is removed, the dead space is inspected for any bleeding or remnant of the lipoma. And now the surgeon is closing the wound. Because this wound is not deep, he is just using non-absorbable sutures for the skin. No need for absorbable sutures under the skin. This type of suture is called simple interrupted sutures. These sutures will be removed in 7 to 10 days. The second suture is taken. After the surgeon finishes the suturing of the skin is grasped and washed with saline, and then a compressive dressing is used over the wound. Thanks for watching and thank you.